Collaboration, a key strategy for social transformation. Yes, when people who are concerned about human welfare come together and collaborate, for sure there is social transformation. Let us try to understand what is collaboration, why collaboration is required as a strategy for social transformation, and how this could be adopted. The basic concepts collaboration and social transformation. What is collaboration? When multiple groups come together for achievement of a common goal, it is known as collaboration. What is social transformation? It is a large scale social change. It refers to the changes in institutionalized relationships, norms, values, and hierarchies. COVID 19 has created a need for social transformation in all nations. Economic instability is witnessed among many nations. Physical distancing has become a barrier in reaching services. Family as a basic unit of society is shaken. There is increase in the magnitude of health and mental health problems all over the world. Workers are changing from work from office pattern to work from home, which is challenging for them. Many workers have lost their jobs and quite a few are facing salary cuts, affecting their social and economic condition and their health. COVID 19 has posed a challenge to the teaching community too. Students at all levels are affected. The most affected are the socio-economically backward, migrants, aged, women, and children. India needs social transformation. Yes, it is because of the problems that are existing in India. The sex ratio is still 949 per thousand in rural areas and 929 per thousand in urban areas. The mean age at marriage is 22 years. The crude birth rate is 20%. The crude death rate is 6%. The infant mortality rate is 34%. The total fertility rate is 3.3%. Maternal mortality rate is 130 per 1 lakh live births. Life expectancy is only 69.6%. The literacy rate is 64.6%. Enrollment in higher education is only 26%, and one fourth of population is still poor. In addition to this, COVID 19 has added problems which requires social transformation in India. Collaboration, if it is a strategy for social transformation, then how do we adopt this? Anyone aiming at social transformation can think of the different types of collaboration. There could be collaboration between people of the same discipline, collaboration between people of different disciplines, and multi stakeholder partnerships or collaborations. For example, the government, non government organizations, beneficiaries, and funding organizations can come together for a common purpose or social transformation. In COVID-19 pandemic, I was able to observe that many of the NGOs in India were adopting collaborative strategy. For example, Yuva, Kashtakari Panchayat, the Stranded Workers Action Network, which was focusing on the welfare of migrant laborers, MCKS Food for Hungry, the Zoho Corporation, FOMRA, Bhumika Trust, Collab Action, Silver Takis, Cycle Relief Riders, FAME, Uday Foundation, Ajivika Trust, Anbagam Trust, Bedscape India, Safa, Akshaya Patra, and Kashtakari Panchayat seats. Collaborative strategy by Anbagam. Anbagam, a non-profit organization located in Chengalpet district of Tamil Nadu, India, has been actively working towards the empowerment and urban, rural and tribal poor since 2007. The strengths of the organization are solidarity and collaboration. Anbagam identified three major areas for collaboration during COVID-19 pandemic: collaboration with government, health professionals, NGOs and corporates. Firstly, myths and misconceptions about corona infection was high among the public. So there was a need to create an informed environment. Anbagam joined hands with We Doctors Corona Fighters, a platform created by Dr. Sunita Dubey, founder of Delhi Medscape India. This collaboration enabled the flow of right information on testing centers, counseling centers, helpline, prevention and treatment, and the information was disseminated to the people. Right information was disseminated to the people. Problems of people in containment zones and in home quarantine, anything pertaining to health were expressed by the members, which was reported to the policymakers. Secondly, collaboration with the local organizations of various districts to reach out to the poor, refugees, homeless migrants, and deserted elderly women and men was adopted by Anbagam. COVID 19 posed great challenges for the NGOs as physical distancing needed to be maintained according to public health norms. When people from various districts contacted the organization for their needs, the local NGOs near the locality were tapped for rendering services. The helping process goes this way: a rapid assessment of people's needs, a brief report on the requirements, budget, and means of procuring the relief materials, which was submitted by the local NGOs, verified by Anbagam, and supported by Anbagam. Relief materials and basic counseling services were rendered by the local NGOs with the support of Anbagam. The most significant aspect was to select NGOs which could collaborate with the district administration, local administration, the people's representatives, police, and it was necessary that they followed the government rules and regulations connected to relief work.